when I step into the situation where I'm receiving feedback, I truly, genuinely see it as free coaching. Hi, my name is Oyepeju Abioye-Akintola. I'm an internal medicine resident physician at Allegheny Health Network in Pittsburgh, Pennsylvania. I'm also very, very big on oncology research, and I'm a future oncologist. I'm hoping to include to help increase the representation of Africans in clinical trials and just a lot of global oncology issues across the world. So yeah, I am also married. I have a wonderful 3-year-old son. My family is literally the light of my life, and it's a pleasure to be here with my long-term friend, Aarin, who is so inspiring, a future hematologist, medical oncologist. I'm so inspired by you, first of all.
Oh, thank you, Peju. Thank you. It's nice to have you here again. So today we're going to be talking about something very important in medicine, very, very important. And for me, it was something I had to deal with more when I moved over to the UK. And from our conversations on the WhatsApp calls, I also realized that it's a theme that you're dealing with in the US. So I don't know if anyone can guess, but I'll not leave you guessing. It's about feedback in medicine. So we are both internal medicine residents currently, and we've obviously had to work in the hospital, interact with senior and junior colleagues, other healthcare workers, the nurses, pharmacists, physiotherapists, you interact with so many people. And I don't know about the US, but in the UK, you get feedback from your consultant, from everybody. It's what we call multi-source feedback. And when you see patients also, you send your tickets to seniors, anyone around who can give you feedback and give you feedback about how you've done in terms of seeing these patients. Yeah. So sometimes when we receive this feedback, we're like, if people say good things about us, we're like, oh my God, you're elated. Or when it's the other way around, the way we respond matters, right? Because good feedback makes you feel good. You can react in different ways to the other type of feedback. So for me, the first question I want to ask you is, what do you think about the culture of feedback in medicine?
Right. Thank you very much for that question. And I'll just start by reflecting back to, med school and how we came up. And it was never called feedback at that point in time,
Yeah.
But we got feedback when you think about it. It's just that it wasn't structured. So I feel like medicine definitely has a strong culture of feedback. And getting into residency exposed me to structured, typically bi-directional feedback. So here in the US, we have Feedback Fridays, right? Typically, which is when your attending physician would call you and then you probably just walk to somewhere. It's a little bit of an awkward walk because you're like, okay, I don't know what this person's going to say, right? And I don't know how the attending feels, but they call each person out like that and then we just walk and then you're like, so how you doing? There's a little bit of a small talk and you're like, okay, can we just get into this? You're like, yeah, it was good. It was a good week, blah, blah, blah. And then you're like, okay, so how do you feel you've done this week? And then you're like, oh, I thought I did this. I thought I grew in this area. I think I still need to grow in this area. And you're like, okay, so this is what I noticed. I thought you did really well at blah, 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 blah. But there are certain things you need to work on. For me, I definitely got feedback about needing to be louder because sometimes I would have the right ideas, but there's something I didn't really realize I was doing. When I'm trying to figure things out, generally, I mumble to myself because I'm like, okay, this. I talk to myself, right? And I didn't realize that I was doing it because so if I don't have the answer yet, I have conversations with myself prior to talking about it.
Right.
Now, when you're in clinical scenarios where you don't really have that time to figure things out first before then giving an answer, I realized that it was something I was still doing. I didn't even realize it, to be honest, until I got that feedback. When I step into the situation where I'm receiving feedback, I truly, genuinely see it as free coaching. Because where else do you get people just telling you about things that you need to do better? It's an incredible opportunity to learn how to be a better person, how to be better at your work, and how to become an efficient leader. So for me, I have gotten to a point where I detach myself from the feedback and I receive it very objectively. And then I take it and because we get it so frequently, I take it into my next week and I work actively on that thing.
Yeah.
So, for example, the week where I got feedback on needing to speak louder, I went into the next week knowing that I'm not someone who typically speaks very loudly, and I'm also not someone who shares my thoughts when I feel uncomfortable about the thought process. It's not like a fully formed thoughts in my head, but it's all part of it. I need to be comfortable with that. And then I did that week. And believe it or not, the feedback I got was, you were so excellent at sharing your, like, sharing your thoughts at doing this. And I'm like, so like, and you were also like really good at challenging certain things that you did not feel was, you just didn't understand and all of that. That was good. And then I got feedback about something else. So what that opportunity afforded me was to grow in real time.
Yeah.
And so I think feedback is a blessing. I think feedback is something that if it is done in a structured way,
Yes.
and without animosity, is a game changer. The only thing is that you never really can tell. I guess you never really can tell if it's done without animosity. And I don't think it's my role to figure out someone's mind and how they feel about me. So I always assume that you're giving me feedback without animosity.
Yeah.
And then I work on it and then I become better. So yeah, that's how I think feedback. I also think feedback is a little bit uncomfortable, to be honest, because like,
The one that showcases our inadequacies.
exactly, it's
Yeah.
uncomfortable to be told, like someone is looking you in the face and telling you,
Mm-hmm.
you're not quite good at this, but in different words.
Yeah.
You're like, ouch, okay, sure, okay, yeah, okay, you know?
Yeah.
But I think it's so much better to be told, to not be told, and to never grow in that area.
Yeah.
And so, two things I would say about our advice about feedback. Never carry a chip on your shoulder about feedback someone gave to you. Never. Don't look at it as this person, even if you feel like it was non-structured.
Yeah.
If you view feedback without animosity, it helps to not carry a chip on your shoulder about it. Because I think that really helps when it comes to growing with feedback. And I've been told a couple of times that I'm pretty good at receiving feedback. So I'm like, oh, okay. So I think this whole process and this whole thought process about feedback has been very, the feedback I got was that I was good at receiving feedback. Can you imagine that?
Which is good feedback.
Which is good feedback.
Yeah. Yeah. Amazing. Thank you so much, Pedro, for being vulnerable enough to share your experiences so far. So my own experience of receiving feedback, obviously, would be in my practice so far. So we do what we call multi-source feedback in the UK. So you have to do this one during a training year, aside the regular feedback you get from your consultants when you send, maybe you've seen a patient with them and you send them a ticket. So in the multi-source feedback, obviously you will get feedback from the consultants. There's a number of consultants you have to get it from, like a minimum number. You get it from the ward clerk, you get it from the physiotherapists, the pharmacists, from the nurses, you get it from your juniors. So they get to highlight your leadership qualities, how well you've supported them. Do you understand? I feel like feedback is like a mirror that showcases us to us. You can, like you said, some people feel feedback with animosity, but let's just remove that out of the equation and see it as a form of free coaching. So there's a place of self-awareness where you're confident in yourself, you know what you're capable of doing. Sometimes even do personal reflections and you say, oh, this is who I am, this is what I learned last week. There's a difference when people who observe you talk from their perception of you and then give you that feedback. There's a different feeling it gives when it actually validates what your self-awareness reflections have, shown you, compared to when they now tell you, okay, you have inadequacies in these areas. If you are someone who is self-aware enough to understand that feedback is not judgment, in quotes, feedback is not an attack on your personality. I feel like it takes a sense of maturity to take a step back and be like, right, you've said this about me. What do I need to do? Do I need to improve in this area? How do I achieve this competency you think I do not have? And then, like you said, you go on to work on yourself. And if it's an environment that facilitates, that is healthy enough, they give you feedback on your progress. And that's how you grow and become a better doctor. So I like that the two environments we work in, obviously, are big on getting feedback and becoming better individuals, because your personal development would, one way or the other, impact on your professional development. Yeah. And as doctors, that would in turn impact the kind of care you give to your patients. So I get feedback like, oh, Aarin is a kind doctor. communicates effectively. So even for me, when I go into an interview, that's what I'm going to be talking about. I'm going to be saying feedback from colleagues have shown that this is what I do. And if I also get feedback, for example, I got one that says you need to be more assertive. So I'm like, okay, am I too kind?
Exactly.
Do you understand? Like, do I need them to be more assertive where it matters? Do I need to like stamp my foot on the ground and be like, okay, this is what's going to happen. This is what I want to do. And, because there are situations like that arise in a team environment where you're working with different people with different personalities. In terms of advocating for your patients, say you're speaking to a different specialty, you're asking them to pick up a patient or to admit a patient on their ward, and this person is being arrogant or is telling you no, for no just reason. So it's not even being assertive for yourself. It might just be, being assertive when it comes to advocating for your patients. So when I saw that feedback, I'm like, okay, what does this person mean? Do you understand? And then sometimes here too, you can reflect on that feedback with your supervisor. If there are areas where they feel like there are concerns, they can call you and have that conversation. So overall, I think the culture of feedback is very important as doctors, as healthcare professionals, not just for personal development, but also for professional development and helping us, provide good standard of care for our patients.
That's incredible. And when you talk about standard of care as well, it just reminded me about like in oncology and in hematology and specialties where they're like clinical trials and all, or when you write papers, like you're always getting like peer review, you're always getting people giving you their opinions about work, and it stings a little bit. No matter how good you think you are about receiving feedback, the truth is it stings a little bit to have someone talk to you about something you need to grow about, an aspect of your life where you think you need to grow. And another tip I was actually going to provide is that one thing that has really helped me when it comes to receiving feedback is that I separate any type of, if I feel like someone is giving feedback and the person is talking about not my work but my person, I don't take that feedback.
Right.
And maybe I need to rephrase that. If someone is actively trying to dig at me, you're not talking about how I can improve my work in any way, but now you're talking about who I am as a person. And I just sense that this isn't, I evaluate every feedback. Like I do a retrospective analysis of the feedback. And I'm like, is this person talking about who I am as a person? For example, let's say someone doesn't necessarily hang out after work. They do their work, they have a good work relationship, but they don't hang out after work because they have other commitments and or maybe their personality just doesn't, allow for it. And then you get feedback about you not being a team player, and then you dig further. Because I also believe that if you think that you don't understand the feedback someone is giving to you, you have a right to ask. What this, just hi, oh yeah. And that's another thing about receiving feedback. You need to go into it with an open mind. So don't be combative. And this will serve anyone like in the workplace, in corporates, as you can climb the ladder in leadership, in management. You need to learn how to have a poker face, in those situations you smile, but you also don't show, you don't make the other person feel uncomfortable. Because another thing we must realize, we're talking about receiving feedback, but we're also going to be people who will be giving feedback.
Absolutely.
And it's a little bit uncomfortable to give feedback because you don't know how the person is going to receive it, right? So if I were to be giving you feedback, Aarin, and your face just changes, concocts into something else, I'm just going to backtrack and be like, I didn't quite, just, find a way around it. But but that's not, it doesn't help growth if we don't learn how to, navigate the whole feedback terrain. So even if someone is giving feedback and the person is taking a dig at your personality and saying, oh, you're not a team player, and then you're trying to find it, like the person's like, well, some of your colleagues after work, they go out for a drink, they go to the pub, blah blah blah, and you've never been there, you don't share those moments with them. And then you ask, but at work, how is my performance? Your performance is stellar. How is my relationship with people at work during the work hours? When we have like maybe gatherings, like just formal social gatherings, am I present? Am I able to interact? Am I Yes, I do realize that at some point in like upper level management, you might have to be more social and, but what
Yeah.
I'm saying is I don't think you need to change your personality because you want to receive feedback. So I think that's where the line is drawn. If I sense
Yeah.
that someone's feedback is more about my personality than about the work,
Mm,
I respectfully say thank you. And if I'm able to explain further why, just give the person a little bit more insight into my person
yeah.
to help them understand, because a lot of the time people just don't understand
Mm-hmm.
because maybe they come from different backgrounds. They've always
Yeah.
done things a certain way. So I try to diffuse that situation by providing a little bit of insight about myself
Yeah.
and just respectfully remaining who I am.
Mm-hmm.
My person doesn't need to change because I want to get feedback.
Feedback. I think that's an important point you've raised. Maintaining your authenticity whilst you're at it. And because we're in the workplace, obviously, I feel like the priority is getting the job done and getting along with your colleagues, maintaining a healthy environment when you're at work. And yeah, for me, that would be the priority. And everything outside that depends on my personality.
Exactly.
To be honest. And I don't think you should change who you are because you're trying to fit in a workplace.
Yeah.
I don't think that would be authentic or real enough. That's what I think. All right. So thank you for sharing that. So currently in the network we have medical students, right? And I know we've been talking about feedback from the aspect of getting feedback from a senior. We are going to be the medical leaders of tomorrow, and we also need to learn to give feedback to the younger people or to our junior colleagues coming behind. And like I said, in the UK, you also get feedback from your juniors, so they tell you how much of a leader you are, and they also send their ticket to you, and you also give them feedback.
I forgot to mention that we also have that system. Like we actually have written feedback as well. So like
Yeah.
from seniors to juniors and attendings too. And I
So,
think that's a good.
you even get from your patients too, patient survey to say, okay, Dr. So was kind when she saw me, communicated well and all. So let's even talk about the feedback you now give to your juniors. So let's look from senior to junior perspective. Have you ever had to do that?
But I'm going to have to do that in like a month
At some
or
point,
so.
yeah.
Like as soon as I get into PGY2 in like a month and a half,
Yeah.
I will be thrust into that position. And I already like for medical students too, I have to like give feedback.
Yeah.
Yeah. But the feedback I've given so far to them hasn't been like super structured because sometimes feedback is emotion. You're just saying you presented really well. Like I
Yeah.
love like that. I loved how you presented your patient. You knew your patient well. And that's such a booster for a lot of medical students, and even at our level as well, like I find that that's always very good. Or I say, okay, you were presenting really well. At this point, you need to say this or bring in this point, or this is how to effectively pre-chat, But yeah, it's that's how I've given feedback. So far, it hasn't been like I haven't given a lot of feedback. And
Yeah.
that's something I'm also maybe working on, becoming more comfortable with actually being in a position where I'm the one giving feedback.
Do you think everyone needs to learn how to give feedback? Because there's a how to give feedback. I remember when I was in the university, we had a lecture. I don't know if it was under community health. I'm not sure. And it stuck with me where we were taught how to give feedback. And I remember the lecturer said, you start with the positive. If you want to say negative feedback, you embed it with, put it in the middle, and then you end with a positive. So it is positive, negative, positive. So you start by saying, oh, you made that presentation well. However, I feel like you could do it better in this number of ways. But overall, that was a really good attempt. So that way the person doesn't feel like a blow has been dealt to them, or, if you keep saying, oh, you did it poorly, I don't know how you even got around to presenting this topic, who even gave you the opportunity? That shouldn't be the way of giving feedback, because whether you like it or not, we're emotional beings. People receive feedback differently. And I feel like as future medical leaders, we should also learn the art of giving feedback and be the future that we want to see. Yeah. So how do you think we should give feedback? Like, do you have any experience of, someone who has given you feedback in a very fantastic way that is memorable to you?
So, it's very fascinating that you brought up the sandwich method.
Yeah.
Because I recently had like a lecture in preparation for PGY2, and I got someone had brought it up and then talked about the fact that it wasn't like it's currently being studied, and it's
Yeah.
probably not as effective as we once thought it was, just because for some people it can be confusing because you're giving like negative feedback in between, sandwiched between like two heavy layers of praise. And some
Yeah.
people they don't have enough time to process what you're saying, and they get confused, and they're like, you telling me I'm doing well, are you telling me I'm not doing
No,
well?
do you? Okay, that's an
You don't
angle.
use it. Or some people also see it as like you're just being patronizing. Like
Right.
you told me exactly. So for example, I come to you and I'm like, I want to be like, Aarin, I didn't like how you spoke to me
Yeah.
on the call we had. That's my feedback. I felt like you were condescending. Then I come and I'm like, Aarin, you're an incredible person. You're a great leader. You're a great mother. And you always dress well as well, you know?
Yeah.
But I didn't like how you spoke to me. So these two things correlate. Like, I didn't like how you spoke to me. You were being condescending.
Yeah.
But I know that you're going to be such a great hematologist, and you will have great patient care, you know?
Yeah.
Like, it's a little bit confusing because you don't even know where my head is.
Okay.
And so like I haven't tried either method, to be honest. But when the person said it, I was like, okay, I'll look into this. And then I looked back into how high I've loved receiving feedback. And I realized that the feedback I've loved the most has been direct
Right.
and genuine. Like, so for example, you just tell me very straight to the point. Of course, you tell me that you think I've done like a great job, but very, very clearly, you tell me that this is where I think you have room for improvement. You're at this point, and I feel like to move from this level to this level, these are the things you need to do, right? And it's very clear that this is the feedback you're giving me. So yes, I feel like when I've gotten clear feedback with actionable steps. So for example, someone telling me, I remember early on in my PGY 1 year, and someone was like, synthesizing the information. I haven't really gotten into a place where I'm synthesizing all of the information well. And what the feedback the person gave was, if you come maybe 15 minutes earlier, you might need to come 15 minutes earlier to get a lot of the information out of the chat, because right now you're not just very comfortable with the layout of the EMR. And that's the major issue. So the person identified that you're not comfortable with the layout of the EMR, and that's why you're not really able to synthesize the information. You may need a little bit more time now. That's not to say you're going to always need a little bit more time,
Yeah.
but that's what you need right now. I'm like, okay, thank you for that feedback. And I did that for a short period of time, and I didn't need that much time anymore.
Right. Right. I hear you. So what I'm hearing is there are different styles of giving feedback.
Yes.
Right. And the most important thing is to tune your ears, even you're receiving tune your ears to hear the actual feedback when it's been given to you in the sandwich method, obviously the indirect way. And obviously the direct way, I think it's also unique to the kind of environment you're in.
That's true.
Yeah, because the environment I'm in, people are not direct. Yeah.
That's so true.
People are not like,
true.
full on, you've done this wrong. No, people are not. I know some people say they prefer the direct form, and some people are like, they prefer people to just sandwich it for them. So yeah. So I like that you're saying this, but obviously it's something we should look into more and talk about more, the different ways of giving feedback. Feedback is very important in medical leadership, and every doctor is a medical leader, whether it's on your ward, in research, whatever it is you're doing out there, you're a leader in healthcare. With seeing that one patient, you're a leader. Seeing one patient and making a difference to their lives, it's leadership. And feedback is a culture that we need to cultivate, learn more about, and do better with. So thank you so much. Do you have any parting words?
Yeah, I think one thing we need to, like, what you said really struck me, and I just realized that this could also be like something that sometimes cause friction when giving and receiving feedback, like different environments.
Yeah.
For example, when you become, because it's a when, not an if, when you become like a multinational leader and you're speaking to people from different parts of the world, that means that the way you and I like give and receive feedback also has to be tuned to how those people have learned how to give or receive feedback like in their own environments. So if I'm coming with my very direct method, which has worked here, to the UK or to England, and I might not get the right response. And if you come with a method that's not as direct and you come here to the US and you're talking to people in the US, you might not get the right response. So it also means that when we're giving and receiving feedback, we have to be especially given, we have to be very attuned to how the people in that place have learned to receive feedback. And, when it comes to like management, upper level management, it's going to be very, very useful to have that skill.
Oh my God. This conversation has been a very insightful one. Very, very insightful. I think we should just convert all our WhatsApp chats into podcast episodes.
I agree.
The world will be blessed.
I absolutely agree. I do.
That's
agree.
what I think. So, well, wow, amazing. Thank you so much, Dr. Oyepeju, for coming on the podcast today.
Thank you for
And
having
I hope our listeners have learned a thing or two. If there's anything that resonates with you during our conversation, during this episode, please put them in the chat box. Check us out on YouTube at EIM Network and on Spotify at the Excellent Lady Docs podcast. Till next time, see you later. Bye.
To wrap on today's episode of the Excellent Lady Dog podcast, if you like what you've heard, don't forget to comment, share, and leave us a review. Follow us on social media at Excellent Lady Dog for more inspiring content. Until next time, keep striving, shining, and being excellent.